Good morning, everyone. Today the topic given to me is on coffee and tea consumption, harms and benefits in liver health. So, as you all know, it is the magical bean for liver diseases and is one of the most consumed beverages in the world. And it has been associated with a decrease in several liver diseases. Not all coffee types are beneficial for liver health, and filtered coffee has a hepatoprotective effect that has been found in most of the studies. As unfiltered coffee may harm the liver due to these two constituents, caviol and cafestol, and they are actually removed by the paper filters. And just out there, that espresso coffee might not be beneficial for NAFL due to added sucrose. So, impact on the chemical composition, preparation method matters, filtration and roasting profile. So, coffee has basically these three key compounds: caffeine, polyphenols, and chlorogenic acid, which have these protective mechanisms through antioxidant effects, insulin sensitization, and all. And the preparation method, if the coffee is filtered, there are no cafestol and caviol, which are actually harmful constituents. And filtered coffee also better preserves these chlorogenic acid which are here, and the caffeine constituent varies. So the caffeine structure looks like the mother nucleus is similar to purine, and within 45 minutes it gets absorbed in the GI system and distributed to all organs and have CNS effects 1 hour later, and it is metabolized by the liver enzyme for these leading to these metabolites, which are then excreted from kidneys. And these are the effects and possible mechanisms of caffeine on reducing ALD, liver fibrosis, NAFLD, and liver cirrhosis, hepatitis limiting to hepatitis C, and liver cancer. So for ALD, it is said to inhibit these signaling pathways. For liver fibrosis, there are many studies, cellular assays, animal experiments, and epidemiologic studies working with the adenosine receptor. And for NAFLD, there are multiple studies where high-fat diet-fed mice, they have been shown that the effects on liver are less if caffeine is there even after multiple strikes. It is protective against liver cirrhosis, as it is said to reduce inflammation and angiogenesis. And for hepatitis C, it reduces viral replication and regulate immune function. There is no evidence for hepatitis B virus as much as is there for hepatitis C protection. For HCC, it is actually, the evidence is quite remarkable. It is said that approximately 40% reduction in the progression from NAFL to HCC, and even it reduces the recurrence of HCC post-transplant through these various mechanisms. So just to tell the layout in which I have compiled these slides, it reduces the all-cause mortality by 14 to 26%. And it is said that there is plateau on 3 cups of coffee per day. Cardiovascular mortality is also said to be reduced by 20%. Then it has the maximum strongest cancer benefit actually in the liver cancer from 40 to 50%, and other non-hepatic cancers as well. Then type 2 diabetes, liver disease, the numbers are relatively more than the other diseases. Then Parkinson's, depression, and cognitive function. Some of the risks, since it easily crosses through the placenta, then pregnancy risks are associated, like low birth weight, preterm birth, and pregnancy loss. And all pregnancy risks are there, and it requires caution. Then it varies from individual to individual. It has been seen that caffeine leads to acute increase in BP sometimes, but it is temporary. And serum lipids, acute increase is seen, which usually normalizes. And there is increased risk in the women's fracture, which is a sex-specific risk. So safety guidelines are 400 mg of caffeine and 2 to 3 cups of 3 cups of coffee actually. Studies on the effect of coffee, I've divided into 6 areas. Liver enzymes. So inverse relationship has been found between coffee consumption and AST, ALT, and GGT. These are dose-dependent beneficial effects and particularly beneficial for high-risk populations. multiple population studies across countries with large sample sizes, they have shown consistent findings, except one randomized study in 1996 where caffeine showed increase in liver enzymes. Then for chronic liver disease, they have protective effects across multiple populations and study designs, where reduced cirrhosis prevalence in CLD patients have been found. And again, more than 2 cups per day has been associated with lower fibrosis, reduced HCC rates, and decreased mortality. And these are effective across multiple risk groups like Hep B, C positive patients, and even the patients which have excessive alcohol intake. This is a study, the largest study from the UK Biobank study, where they enrolled more than around 5 lakh participants, and with 10.5-year median follow-up, where all coffee types have been found to be protective, ground coffee, instant, and decaffeinated as well. Although some studies say that decaffeinated coffee is not as effective as the caffeine in the coffee, which is protective. But however, in this latest study published in 2021, they showed that all types of coffee have been found to be protective for CLD or steatosis, HCC, and even death from CLD. Only coffee-based caffeine shows a protective effect, and non-coffee caffeine sources have not showed any benefit. Regarding liver cirrhosis and mortality, these are the various studies which have shown the protective effect of coffee. But again, coffee but not other caffeine-containing beverages have found to prevent alcohol cirrhosis. And 3 or more cups have shown to be the plateau for showing the protective effects. So the odds, as we increase the cups of coffee, it is the odds ratio for cirrhosis development is there. And in this particular study, they have shown the plateau after 4 cups per day. These are various long key studies with long follow-up, 10-year follow-up, 22-year follow-up, which are all consistent with the protective effects of coffee against both hospitalization and death from alcoholic cirrhosis. And mortality rates were found lower in persons drinking more than 3 cups of coffee daily than less than or equal to 2. Then these are the large population studies which have shown dose-dependent inverse association with non-viral hepatitis cirrhosis, but no association with hepatitis B-related cirrhosis mortality has been found in any of the studies. Although hepatitis C, there are various beneficial effects with hepatitis C, which I will be showing. And benefits are seen across different coffee preparation methods. So regular coffee is more beneficial than a total caffeine intake through any of the sources. But interestingly, no protective effect was observed with the tea consumption whatsoever. With hepatitis C, the lower disease progression, reduced histological activity, and serum ALT stabilization has been seen in major studies. And this is a major HALT-C trial where disease progression was reduced, and treatment benefits also included better PEG interferon tolerance, improved virologic response to treatment, and reduced adverse effects in HIV, HCV co-infection. And hepatitis B, there is limited evidence, and no study that I have come across have shown clear benefit in this. Regarding NAFLD, multiple studies have shown consistent protective effect against both the development and progression through various stages, and there has been found to be inverse association with obesity and insulin resistance. Regarding liver cancer, again 38 to 41% with 2 to 4 cups per day, and up to 72% it has been shown for risk reduction. And the benefits have been observed in both boiled and filtered coffee. And coffee on a daily or almost daily basis had a lower HCC risk than those who almost never drank coffee, showing the dose response effect. 40 till up to 70% it has been seen, and benefits are also observed in hepatitis patients. Regarding tea, one landmark study I have come across is the Rotterdam study, in which they said that frequent coffee but herbal tea consumption as well has been consistently correlated with a significant lower risk of liver stiffness and it is the first study to examine in depth the relationship between tea and liver health. But the study faced a critical, serious backlash regarding the controversial role that herbal teas have in association with the liver injury, giving to the liver injury. And it was pointed out that they did not do any analysis on the herbal tea components, to which the author's response was that they majorly studied the Caucasian population, where pre-packaged mainstream herbal teas were being studied, as opposed to the different Asian countries like India and China, where different compounds are being used as a part of traditional medicine, which can be harmful, and more cause-effect relationship studies are needed to confirm those. But in this particular study, in their Caucasian population, they have shown these findings regarding herbal tea. Then there is something called white tea, which also alleviates the high-fat diet-induced obesity and liver steatosis, and it regulates the expression of gene with lipid metabolism and slowed NAFLD progression. Then there have been various studies on several tea extracts on NAFLD in mice fed with a high-fat diet, and they have enumerated these effective teas for up to 50% weight reduction, best for fat mass reduction and liver triglyceride reduction, with these active compounds, gallic acid and ellagic acid in these, and these key benefits, but to be used with caution. For alcoholic fatty liver disease as well, they have these enumerated teas which are best for gut bacteria restoration, and they play a role in strong microbiota regulation with high gallic acid again, and the caution was that black tea showed minimal effects and possible inflammatory response, and the benefits are it reduces the liver enzymes, inflammatory markers, and increase the antioxidative capacity while restoring the gut microbiota. Then this is a meta-analysis on the green tea intake on risk of liver disease, which has again showed a maximum overall risk reduction in the HCC, hepatocellular carcinoma, with liver steatosis, although there was some publication bias on HCC and steatosis in this. But it has also showed risk reduction in chronic liver disease and hepatitis. But the study, it did not differentiate between the specific green tea varieties, tea concentration, preparation methods, etc. So various limitations were seen when they interpreted the health benefits of tea or coffee. They did not take into account socioeconomic status or dietary factors. And coffee drinkers, although they have taken care of confounders, but coffee drinkers may also have high cigarette and alcohol use. And many studies measured coffee intake at just one point of time, potentially misinterpreting the actual consumption over time. And variations in caffeine content within and among coffee shops may impact the hepatoprotective effects attributed to caffeine. And while saying that the plateau is on 3 cup size, they did not define coffee cup size, leading to ambiguity about the amount. Potential harms with tea, I could find the increased gastric cancer risk and esophageal cancer risk with very hot tea. Potential harms of coffee consumption is as enumerated: pregnancy-related risk and women health. And various cautions are that individual genetic variations matter while consumption of coffee, and there is short-term rise in blood lipids, blood pressure, and effects may vary by preparation method. So these are the various take-home findings that it show decreased liver fibrosis risk, 3 cups of coffee a day associated with lower NAFLD risk, especially filtered coffee. Multiple studies indicate protective effects against these liver conditions, and it plateaus after 3 to 4 cups of coffee, and optimal consumption varies by the outcome. There have been varying regional differences that have been found, strongest in Europe with 22% lower risk, then followed by Japan with 18% lower risk, and then moderate in the US, lower than these two. This can be because of the difference in the coffee preparation method, dietary pattern, and other lifestyle factors. And similar benefits for caffeinated and decaffeinated coffee, but findings may vary because some studies say that decaffeinated coffee is not as beneficial as caffeinated one. And benefits are most pronounced in non-smokers, suggesting that smoking is a crucial effect modifier. Then equal protection for men and women, and some studies reveal stronger protective effects of coffee in women, lower all-cause mortality in women than males. And these are the safe consumption guidelines, but individual tolerance varies and drug interactions have to be taken in consideration. These are the various beverages: caffeinated coffee, caffeinated tea, decaffeinated coffee and tea, and cola drinks. So caffeinated coffee has the highest risk reduction because it is rich in antioxidants and polyphenols, followed by caffeinated tea, then decaffeinated coffee, and so on. So this is the summary again, backed by the evidence. These are the references, and